from the Lakeside Newsroom of the Henrico Citizen, your hometown news source since 2001. This is the Henrico News Minute with publisher Tom Lapis.
How are Henrico Health District officials prioritizing seniors in the latest round of COVID vaccinations? We'll tell you coming up on today's Henrico News Minute. It's Tuesday, February 2nd, 2021, and it's brought to you today by Henrico County.
And now for the news.
Richmond and Henrico Health Districts administered more than 15,000 doses of COVID-19 vaccine during the past week as they continue to work their way through a list of more than 104,000 people in Henrico and Richmond who have expressed an interest in being vaccinated during Phase 1B of the process. That's all according to RHHD officials. Sunday's snowstorm forced the delay of a third day of a planned 3-day mass vaccination effort for seniors in the region, but the 2,500 doses that officials had scheduled for that day will be administered today instead. Now, the health districts had been receiving 6,400 doses per week from the state. This week they received 6,300 because of an adjustment. All states will be receiving about 16% more doses beginning next week from the federal government. That likely will result in at least several hundred more doses locally, but officials are not exactly sure about that yet. Health District's nurse manager Amy Popovich said yesterday during a press briefing that the districts are prepared to vaccinate about 25,000 people weekly. They just lack the doses to do it. Henrico continues to be second statewide in the total number of residents who have received at least one dose of vaccine. That's just more than 36,000, including more than 5,000 who are now fully vaccinated. Within the category of senior citizens, officials are using three main factors to prioritize those who have completed interest forms. That's according to RHHD Health Equity Director Jackie Lawrence. She said first officials are considering age, then race, and then sign-up date. A group of employees, including a leadership team, and Lawrence and her equity team are responsible for determining who is eligible to be vaccinated each week. Now, the people whose names are pulled each week are emailed and then, if necessary, called twice by health district officials in an attempt to register them for a vaccination event, according to Popovich. But if those three attempts don't work, the callers will move on to other people. But she said if you missed a phone call or missed an email, you won't be removed from the list or bumped to the back of the line. Officials will try to contact you again soon. This week, the health district also is beginning to reach out to seniors who live in the 50 or so independent living facilities in Henrico and Richmond. They are prioritizing those who live in government housing first, followed by those served by Medicare, and then those who have private insurance. You can read much more about this topic on henricocitizen.com by clicking on COVID-19. Later today, the Henrico Board of Supervisors will hold a virtual meeting to provide an update on COVID-19 vaccination efforts here in the county. It'll be held from 5:30 to 7:30 in the Board of Supervisors room at the Henrico County Government Center, 4301 East Parham Road. You can also participate or just watch the event online. Visit henricocitizen.com, click on News and then Government to read this article and find the links to the event. And you can also visit henrico.us/health to complete an interest form if you are eligible for the COVID-19 vaccine currently. The Virginia Senate voted recently to approve a bill that facilitates the administration of the COVID-19 vaccine. The vote was 37-0. The bill would require the Department of Health to create a process through which any healthcare provider in the Commonwealth who's qualified and available to administer the vaccine can volunteer to do so. Henrico Senator Siobhan Donovan introduced the bill in the Senate. It would speed up distribution by eliminating licensing and legal barriers that prevent medical care workers from volunteering. Henrico Delegate Lamont Bagby proposed a similar bill in the House. Donovan said that there are many nurses in the state who are willing and able to be a part of the workforce to vaccinate Virginians. But yesterday, Henrico reported 161 new cases of COVID after having reported just 263 in total this weekend. The county's 7-day daily average of new cases continues to decline. It dipped to 173 cases yesterday. Sunday's total of just 92 new cases was Henrico's lowest single-day total since late December, though the VDH indicated yesterday that case counts reported on Sunday might be lower than average, and those reported Monday a little higher than average because of system upgrades. In good news, there was only one new virus-related hospitalization and no new deaths related to the virus in Henrico reported yesterday. The county's PCR positivity rate over the 7-day period ending January 28th was 11.2%, and its rapid testing percentage over the same period was down to 7.7%. Well, if you prefer to listen to the news rather than read it, and since you're listening to this, I'm going to guess that you do, we're making it a little easier for you to do that. You can visit henricocitizen.buzzsprout.com, and you'll be able to listen to all the articles that we post on henricocitizen.com from that one location. Again, that's henricocitizen.buzzsprout, buzzsprout.com. Today's Henrico News Minute has been brought to you by Henrico County's Spread the Love Valentine's Day Card Initiative, sponsored by the Henrico County Engage program, which is inviting you to help make homemade Valentine's cards for the 8,000 long-term care residents in Henrico County. Cards are due by Friday, February 5th. For details, visit henrico.us/services/seniors.